Hi, I'm Dr. Jamie Reynolds.
And I'm Dr. Andrea Dopp with Spillane and Reynolds Orthodontics.
So at the orthodontist, one of the questions that we get all the time is how early should I bring my child in for the first evaluation? Now, the American Association of Orthodontists recommends a first visit at age 7. So a lot of people, when they first hear that, they think, wow, that's really early. The reality is we've gotten smarter at the way that we diagnose and treatment plan things, and there's a small percentage, about 15%, that really benefit from seeing the orthodontist early to prevent small problems from growing into really big problems. So we're going to review 6 conditions that you should watch out for in your kiddo to know if it's a good time to take them in to visit the orthodontist.
One condition to watch out for are extremely crowded teeth. Now, if your kiddo's baby teeth are all really nicely touching in one tight little row, chances are really good that there will be some severe crowding down the road. If you start to see a double row or a shark row of teeth where the permanent teeth don't quite have room, make sure you get in to see your orthodontist. They'll let you know if early treatment is indicated to make sure that the jaw has room to accommodate all of the permanent teeth.
Another thing to watch out for is protrusive teeth. Some people call it buck teeth or big overbites, and that's where the front teeth are really far in front, flared out of the bottom teeth. That dramatically increases the risk of damage to those front teeth. So the last thing you want is an afternoon on the playground resulting in fractured teeth that mean trips to the cosmetic dentist for the rest of your life. If you see that big overbite, make sure to get it looked at by an orthodontist. Something a little trickier to watch out for is crossbite. Your top teeth should bite outside and surround the bottom teeth all the way, but when one of the top teeth bites inside of the bottom teeth, we call that a crossbite. Those are typically treated with expanders, and expanders work on the growth plate in the upper jaw, and that works much better in 7, 8, and 9-year-olds than it does in 12 and 13-year-olds. Why? Because that growth plate starts to seal, which can make the expander less effective and also much more painful. So if you're looking at expander, the main reason to treat it is with a crossbite, and so you want to get that checked out early.
Another thing to look out for is an open bite. As I mentioned before, having too much overbite is a bad thing, while not having enough overbite is also a bad thing. Open bites can happen from things like having a thumb habit or having what's called a tongue thrust, where the tongue is postured forward into the open space between the top and the bottom teeth. Treating a tongue thrust at an early age is much more effective and much more predictable than it is further on into adolescence.
Another thing we can diagnose at the orthodontist is obstructive sleep apnea. It's a condition where some of the growth and development of the face can block the tube with which they're breathing. That results in decreased oxygen supply for the child when they're sleeping, which oxygen is basically the gasoline that runs their body and fuels their growth and development. With the sophisticated 3D x-rays that we have, we can diagnose airway blockage very easily and very quickly. One of the things that's often mimics the symptoms of sleep apnea is ADHD, and it's possible that kids that are diagnosed with ADHD might be suffering more from airway blockage and sleep apnea instead. So another great reason to get your child evaluated at an early age at the orthodontist. Some people's teeth, when they're visibly crooked, leads to the kids getting picked on at school or socially. Waiting until they're 12 or 13 years old to start orthodontic treatment might result in years of issues with social development and kids being picked on unnecessarily. So if you notice them coming home and complaining about social concerns with their teeth, bring them in and have an orthodontist diagnose what can be done.